Alright, for a ulnar ligament acute injury, we're going to start off with RICE. First thing we're going to do is go ahead and rest the extremity. This will prevent any further injury to the extremity. Do this for about 48 to 72 hours. Also, we're going to ice the extremity. We're going to put ice on the extremity to decrease cell metabolism, which will help decrease the need for oxygen and also decrease the inflammation in the area, and it'll further hinder edema in the joint. Contraindications for icing would be cardiac or respiratory involvement, uncovered open wounds, circulatory insufficiency, cold allergy and or hypersensitivity, and anesthetized skin. Next up, we're going to use compression as well, along with the ice, to help reduce edema. It's not so much going to reduce the edema, but the compression, or intermittent compression, which we're going to be using in this case, is going to help push the edema or the fluids out of the elbow joint and back into the venous and lymphatic circulation. Contraindications for intermittent compression are acute conditions in which the possibility of fracture has not been eliminated, condition in which the pressure would further damage the structures, peripheral vascular disease, arteriosclerosis, edema secondary to congestive heart failure, ischemic vascular disease, gangrene, dermatitis, deep vein thrombosis, and thrombophlebitis. Along with icing and compression, we're also going to elevate the extremity. This is also going to further help with moving the edema or swelling in the fluids that are inside the elbow joint, pushing back into the vasculature and lymphatic drainage. Now, when we set this up, we're going to be using a Game Ready. This Game Ready provides icing and compression at the same time. Use the appropriate wrap. Have an elbow wrap here or sleeve. Wrap it around. Plug it in. This will be providing pressure, intermittent pressure with ice water. We're going to set up for about 3 to 1 ratio, 30 seconds on, 10 seconds off. And we're going to do this for 20 minutes at a time, possibly 2 times a day. So extremity is elevated, pressure, and the pressure should be less than diastolic pressure. Okay, good.
Modality is interferential stimulation. This is for pain control. We're doing the acute stage, so pain control is the gate theory. The A beta fibers are much faster than the C delta fibers, thus closing the gate behind them and inhibiting pain. In the later stages, we reset the frequency and you control the endogenous opiates with contractions. The contraindications for this would be cardiac disabilities, demand type pacemakers, pregnancy, menstruation, cancerous lesions, sites of infection, exposed metal implants, areas of particular nerve sensitivity, such as the neck, things like that, severe obesity, epilepsy, and electronic monitoring equipment. We're going to use 4 pads, and we're going to cross the pads over our area. Our ligament is right in here, and we're using 2 different frequencies. Like I said, we're wanting to crisscross them to hit a point in the middle. And I'm going to look for pins and needles sensation is what he's going to be telling me about. And we can also use this with our Game Ready during the RICE.
The next modality we'll be using is the therapeutic ultrasound. This we'll be using to increase cell membrane permeability, tissue regeneration, and stimulate phagocytosis and synthesis of collagen. This is in the acute phases of the injury. In the subacute and chronic phases, we'll be going for increased nerve conduction velocity, increased susceptibility of collagen-rich structures, increased blood flow, increased macrophage activity. Right now, since we're working on acute, we're just going with non-thermal. Our settings will be on a pulse of 10 to 20%. Treatment duration is usually 3 to 12 minutes, but we'll be going with 5. Alright, when we do the ultrasound, we'll be using a medium, which is a gel, for the ultrasound. Otherwise, we will break our equipment. Turn that on. We'll turn the ultrasound on. Turn the frequency on 3.3 since we're going for a shallower depth. The ligament is next to the skin. We're going to do cycle 20%, time 5 minutes. We'll be going in circular motion 2 to 2.5 times the size of the area. And watts per centimeter squared, we'll be going with about 1.2. The athlete complains of pain or burning sensation will decrease that. Contraindications for ultrasound will be acute conditions, ischemic areas, areas of impaired circulation, over areas of deep vein thrombosis, anesthetic areas, over cancers, tumors, over sites of active infections or sepsis, over the spinal cord or large nerve plexus, exposed metal, penetrates the skin, areas around the eyes, heart, skull, or genitals, over the thorax in the presence of an implanted pacemaker, pregnancy, or when used over the pelvic or lumbar area, over fracture site before healing is complete, stress fracture sites or sites of osteoporosis, over the pelvic or lumbar area in menstruating female patients. Nothing.
For our next modality, we're going to use a contrast bath. Any contraindications for our contrast bath? You wouldn't use it for an acute phase since it's a subacute phase. It's all right to do it. You wouldn't use it if the patient has a fever or if they have any cold allergies. You would not use a contrast bath if the patient had any skin conditions or open wounds or anything like that. And our hot bucket is set at the temperature's around 108 degrees Fahrenheit, and our cold bucket is around 55 degrees Fahrenheit. And the treatment time will be 20 minutes, 3-to-1 ratio, 3 minutes in the hot, 4 minutes in the cold. That way we'll end in the cold for the subacute phase. And basically what a contrast bath does is it acts as a pump. The hot water will vasodilate and the cold water will vasoconstrict, creating a pump to rid the injured area of any debris or fluids. So I'll just have you, I'll keep the time and you submerge in the hot water bucket for 3 minutes and then switch to the cold for 1 minute. Okay, and it's been 3 minutes, so I'll just switch to the cold. Yeah, it's been a minute, and we'll just have them end in the cold.
Our next modality is thermal heat packs. We will be using them to control pain and also increase elasticity to the muscle and tendon and fascial area. Primary effects, of course, increased cell metabolism, increased blood flow through vasodilation, and muscle relaxation secondary to reducing muscle spindle sensitivity. These packs are stored at about 160 degrees Fahrenheit. Will be applied for about 20 minutes. Contraindications would be acute conditions. Of course, we're in the subacute now, so we don't have to worry about it anymore. Also, impaired circulation and poor thermal regulation. They're kept in this wrap as to avoid direct skin contact. So we're going to apply it to the area right here. And we can also use a towel to place between his stomach and the pack, or his arm if it's uncomfortable.
During the chronic phases of the ulnar collateral ligament injury, it is crucial to ice the extremity after any physical activity to decrease inflammation or pain by causing local vasoconstriction and anesthetizing through the cold modality. Contraindications are cardiac or respiratory involvement, and covered open wounds, circulatory insufficiency, cold allergy or hypersensitivity, and anesthetized skin. After this, we'll leave it on for 20 minutes. Actually send the athlete on his way. Let him take it off after the time period.